So Dr. Kim, can you tell us a little bit more in details what are the methods used for breast augmentation in Korea?
Breast augmentation is roughly divided into two ways, one being a process that uses implants, and the other is a fat transplant. The most common method that's used right here in Korea is to use implants. For fat transplants, it's difficult for new fat to adjust inside the body because of the amount of fat, so it is hard to see dramatic effects. There are some cases that use fat transplant as an additional procedure after having implants in order to get bigger sizes, but only using fat transplant for breast augmentation isn't at all common.
Doctor, so what are the kind of implants that are currently used?
For implants, there have been a good amount of different types. The first implant introduced was made with liquid silicone, but liquid silicone was considered harmful, and then it was decided that they'd replace it with saline. Then they realized the texture of the saline wasn't that great, so at one point, some used thick sugar water implants. Shape was another thing. There were these textured implants, which had a rough texture, and along with that were also smooth implants. The ones we use in recent times are round, smooth type implants. These are filled with silicone, but they're a lot different from the liquid silicone that we discussed earlier. This right here is what's inside of these implants, the silicone gel. As you can see, it doesn't spill out. It's quite viscous. We describe it as cohesive, so we call these cohesive gel implants, or co-gel implants for short here in Korea. This one, right here, this is the implant that we use.
Right. So this kind of implants can be used permanently after the surgery?
Oh, of course. There are some people who question whether or not they have to replace their implants every 10 years. Makes me wonder where that story even started. I'll make it clear. Implants last very long without problems whatsoever.
So what is the recovery process after the breast surgery?
I'll explain the process based on my own procedure. When I do the operation, I usually do an armpit incision and an under chest incision. I'll make it clear that the recovery process for both is similar. After the surgery, I start off the recovery process by compressing and wrapping the chest. And then, the bandages are off by day 3. After a week, I remove the tape that I attached for correcting the chest. Then the therapy is over. No need to remove any other stitches. And there are no devices, such as a surgical drain, to remove any blood. So what I usually explain to patients is that breast augmentation only hurts at the first day, then it feels stuffy till day 3. And after that, there are people who complain of itching because of the tape. 4 days of itching, and then it's over. Remember, 1 day of pain, 3 days of feeling stuffy, and 4 days of itching.
Okay. So after the surgery, how long does it take until the breast feels like natural?
That's such a hard question to answer. Recovery differs for each and every individual. Some people have it feel natural more quickly, while others are relatively slow. In all plastic surgery procedures, we could expect an average of 6 months until they fully recover. So with that, expect that it'll get better in about 6 months or so.
Okay. So what does the patient has to do when going home after the breast surgery to maybe accelerate the recovery?
At the early phases, utmost care must be taken to ensure that the implants do not deviate from their position. Since for some patients, they find it difficult to be careful, we give them corrective garment to wear in order to remedy this. Aside from that, certain postures that pressure the chest, like most poses in yoga, have to be avoided in order for the patient to have no big problems in their daily life.
Okay, so please let us, this is my last question, what are the side effects of this kind of surgery?
So, if one decides to get breast augmentation, one side effect that most people are afraid of is contracture. To explain contracture, when this implant enters the body, a tissue called the capsule forms around the implants. For whatever reason, the capsule around the implant gets solid. We call this phenomenon capsule contracture. This is definitely one of the worst side effects there is. The causes for this occurrence vary widely. Maybe it's blood gathering due to blood loss during the surgery, or it's accompanied by inflammation, which is the most common cause. With the methods I used recently to perform this kind of surgery, I perform the operation making sure my patient won't bleed. I remove any remaining blood after the operation. And of course, after the surgery, one should be careful that there aren't any infections. And with disinfection and medication, it is preventable. I've been doing operations for over 20 years. If I recall the past 5 years, for the first operation, not the second operation, there were almost no contractures. I can confidently say that there were none.
Okay, perfect. Thank you, Dr. Kim, for the interview today.
Today, I talked about breast augmentation. There's still a good amount of people that are scared when it comes to breast augmentation. But compared to other plastic surgeries, it is not that difficult. The incision is not that big. So, if by any chance you're interested in breast augmentation, you can always come and have a consultation with me.